All right, we're going to go ahead and get started. Hi, everyone. My name is Denise McConkey, and I am a career and life design coach here in our Career and Life Design Center. I'm excited to be here to talk with you today about public health resumes. Um, Before we get into the actual content of the presentation, I just wanted to let you know that I want to make this as interactive as possible. So if you have a question or comment about anything that I'm talking about throughout the presentation, please feel free to put your question or comment in the chat. I'll definitely try to monitor that as much as possible. Also, you can feel free to unmute yourself, turn your cameras on, and ask your question or make your comment. Like I said, I think it's best if I have some slides prepared, but if we can make this more conversational, that would be awesome. So please feel free to do that. Also, before we get started, I was just wondering, I know we just have a small group here, if the people that are attending would be willing to just take a second and introduce yourself and kind of share your name and what year you are in the program and what you're looking to get out of the workshop today. If you would be willing to do that or put it in the chat, that would be great.
Thank you, Dennis. My name is Olubenga.
Hi.
Um, I am in my second semester. I'm in my first year, second semester, um, in the public health program,
Okay.
and I hope to I hope to learn how to further refine my resume in order to reflect what a public health resume should look like. And then some things I need to put in, some things I need to remove, maybe, and then learn more about making a a profound resume for job opportunities. Yeah,
Okay.
yeah.
Great. Thank you. I appreciate you sharing that. Anyone else?
Hi, Denise. My name
Hi.
is Shravya Yasarapu. I'm in my final semester of my MPH program. I'm currently looking for any potential job opportunities that I come across. I
Mhm.
really want to know how I can tailor my resumes and cover letters for each of the job I want to apply for.
Okay.
Um, that would be really helpful if you can direct me how to do that, if you provide your insights. Also, I keep hearing that the resumes have to be a page long, to be like more concise and um, concise. So, uh,
Mhm.
I'm expecting to learn that from you, how to concise my resume in one page. So that's all I'm looking forward to. Thank you so much.
No, I appreciate you sharing that. So today we're mainly going to focus on resumes. And
Uh-huh.
I think with what you both shared, we're definitely going to address those questions that you may have or concerns. We're not necessarily going to talk about cover letters, but if we have some time at the end, I'd be happy to talk with you about that. And I can show you some great resources that we have too, but appreciate you sharing that.
Thank you.
Anyone else? Jerry Lynn, you willing to introduce yourself?
Yeah, sorry.
That's
Hi,
okay.
my name is Sherilyn. I recognize and nice to see you guys from class, and I hope everything's okay with your semesters. But anyway, um, I am a second year into the program, and I'm hoping to learn more about resumes for this coming up. I have to start finding the practicum or internship for this coming summer.
Okay, great. So yeah, this information will be applicable whether you're applying for your practicum experience or full-time position. So great. So I appreciate all of you sharing and thanks for joining me today and spending some time with me. So we'll get right into the content of the presentation. So just a very brief, quick agenda. So I'm just going to start with a quick overview of our Career and Life Design Center and how we work to support students in the School of Health Science across campus. And I'm here to support you throughout your entire time in the MPH program. So we'll give you just a little bit more information about that. And then we'll quickly transition into talking about public health resumes. And I'm going to provide you with some tips so you can learn how to really make sure that you're leveraging your skills and your qualifications that you may have developed through your classes as well as your previous work experience and practicum experience. So because it's really important to make sure that you're doing that because that's going to help you stand out to employers and show that you're a good fit for the position. So that's going to be kind of the main focus for today. And again, if any questions come up as we're going through this content, just please let me know. Okay, so as I said, there are many different ways that you can engage with myself in the Career and Life Design Center. One thing, if you're not aware of already, that I wanted to let you know about is we actually have two wonderful graduate level students that we have for our School of Health Sciences Professional and Career Ambassadors, Asha and Kanisha. They're actually both in the public health program as well. And they have been trained to provide you with some peer-to-peer support when it comes to some of the things listed on the slide here. If you're looking for your practicum or in full-time position, Handshake is a great resource for you. It's our online database for OU students and alumni, and they can help you with navigating that system so you're able to find the types of opportunities that you're looking for. Also, we've heard the importance of networking, right, in your job search, and LinkedIn can be a really good resource for that. So if you are not on LinkedIn already, definitely encourage you to join LinkedIn and create a free profile because that's really going to give you the opportunity to network with industry professionals, no matter what area of public health you're working in. We have public health alumni from Oakland University that are on LinkedIn as well that you can connect with. So it's really an important tool to make those industry professional connections. Also, obviously, we're going to focus on resumes today, and one of you asked about cover letters, but you can sit down one-on-one with either Asha and Kanisha. They have office hours in the School of Health Sciences, basically off and on Monday through Thursday. And so they're going to be able to take a look at your updated resume and give you that personalized, customized feedback. So beyond today, if you want some personalized feedback on your resume and cover letter, they're gonna be the ones that can really help you with that. You're welcome to schedule an appointment with me too, don't get me wrong, but they're also trained to help you with that and give you specific recommendations on how you can improve your resume. And then if you ever need help with your elevator pitch, your professional introduction of yourself to an employer that you would use like at a career fair or a networking event, that's something that they can help you craft and then practice as well. So you feel comfortable with saying your elevator pitch to an employer. We'll talk a little bit more about that in an upcoming workshop, more related to job search and things like that. So more on the elevator pitch. Like I said, you're also welcome to meet with myself or one of our professional career coaches here in our central office in 103 North Foundation Hall. And I can sit down with you and have a more, customized, in-depth conversation about your search for either an internship or a full-time position. Obviously, we have Handshake, but I have some additional job search strategies that I can share with you to help you kind of customize your search. We also offer practice interviews, mock interviews to help you with an upcoming interview, whether, again, it's for a summer internship practicum or a full-time job. It's a really great way to give yourself an opportunity to practice responding to interview questions, and then I'll give you feedback as well. So once you answer the question, I'll let you know what was good about your answer, and if necessary, I'll provide you with some tips on how to improve your response to specific interview questions. So that's really good practice. And then I know public health can be pretty broad, right? It's a pretty broad industry program, sorry. And there's a lot of different things that you can do with your degree. So if you're unsure, you're interested in a lot of different things and you need some help kind of narrowing it down, or coming to the realization of what position would be the best fit based on your interest and your skills and things like that, we can schedule a career exploration appointment and kind of talk about those types of things in more depth. Keep in mind, these appointments can be scheduled either virtually or in person, and you can schedule the appointment through Handshake. There's an appointment tab that you can click on, as well as through contacting our office. Let me just show you really quick. So once you log into Handshake, let me just change the view. I apologize, I meant to do that. You can see this is the main page, and then if you just click on Career Center, and then it will take you to a page where you can schedule an appointment. So that's the quick link for that. And again, when you schedule that appointment in Handshake, then you can select what type of appointment you would like, virtual, in person, over the phone, whatever the case may be. As well, we have a great event coming up. It's not until March 14th, but it is our more niche event for individuals within the School of Health Sciences, School of Nursing, and then those natural science majors within the College of Arts and Sciences, and this includes public health as well. We have had some healthcare related organizations looking to connect with public health students. It's our exploration fair. And again, it's a more niche fair for companies and students looking to work in healthcare and natural science related organizations. So it's the event is already in Handshake. We've already had some companies register. It's on March 14th from 12 to 2 p.m. in the ballrooms in the Oakland Center. But definitely keep checking Handshake because we've just started to have companies register for that. But that's a really good opportunity for you to make that face-to-face personalized connection with those company representatives. And then you can learn about the various opportunities that might be available to you as well. So great opportunity there. Any questions on any of our services or anything I've talked about so far?
Not for me at the moment.
Okay, great. Oh, did someone say something? Okay. So let's get into talking about public health resumes. So as you know, your resume is used to promote your qualifications, your academic preparation, your experience, basically what you have to offer to the employer. But I think one of the things that students do is they don't take advantage of this opportunity to really give like detailed, specific information. They really don't include enough detail on the resume. So today we're going to talk about how you can do that to really, make sure that you're leveraging your skills and your qualifications, and having your resume stand out to employers again, like I said. So the thing that I think is incredibly important when it comes to your resume, and you may know this already, so this is just kind of a reminder, but it is really, really important to take a little bit of extra time to tailor your resume to each position that you're applying to, whether it's your practicum, internship, or a full-time job. Because even if it's in the same field, like health education or epidemiology, the skills, the qualifications that they're looking for may vary by company, right? So I think it's really important to review that position description in detail, look at the specific responsibilities of that position, what qualifications they're looking for, and think about how can I align my skills and my work experience and some of the things I've done through the MPH program to make sure that they realize I meet the majority of the qualifications, right? So that can be, again, skills, experiences. Maybe you have some relevant training. I mean, sometimes even like Narcan training or first aid, CPR, even those certifications, can help help make a difference and help you stand out a little bit more. Because, you know, it definitely, if it's a health educator position, obviously they're going to be looking more for like public speaking, program planning, evaluation skills. But when you think about more like a clinical research position, then they may be looking for more like attention to detail, ability to work independently. So you can see the focus and what you emphasize would be a little bit different based off of those two examples. So, again, just like a reminder, because I know sometimes students say it takes a lot of extra time, but it definitely is worth it. Okay, so now we're going to just get into kind of the different sections of the resume and give you some tips based off of those. Obviously, at the top, you have your header information, right? Your name, your contact information. If you are on LinkedIn, it's great to include the link to your LinkedIn profile so they can click on that or put it in, you know, into the laptop to get more information about you beyond what's listed on your resume. You don't necessarily need to include your physical address, just your phone number and email for your contact information. So that's what we recommend for that. So that's pretty straightforward. And so I wanted to ask you this question. And again, unmute yourself and answer, or feel free to put it in the chat. How many seconds do you think an employer takes to review a resume? Yes.
I read somewhere 6.
6 seconds. That's exactly correct. Yes. 6 seconds to review a resume. That is not very much time, right? So one way that you can grab an employer's attention right away and add focus to your resume is to include a statement at the top. I have a couple of examples here of either an objective statement or a summary statement. And so you can see how right away, because really it should be listed right after your name and your contact information up at the top of your resume. So that's like prime real estate, right? You want to make sure that you're including the most important information at the top, and then you work your way down from there. So that statement is going to identify, you know, what you're passionate about, what you're interested in, what skills you have, as well as what type of position you're interested in. So if you're in a situation where you haven't done your practicum yet, you kind of have limited experience, you may lean more toward the objective statement. So that's a little bit more straightforward. So that identifies, you know, what type of skills and experiences you have what types of skills that you have that you can offer the position, as well as, you know, what you're interested in. And then the summary is going to just kind of expand on that a little bit more and provide some additional information as far as, again, your skills, what experience you have, but also if you have achievements that you can include and things like that, you know, that can be helpful as well. So you can kind of read through those and see the difference, but you can see the summary sample is a bit more lengthy. And it looks longer on my slide just because the font is really large. You don't want to make it too long, but you get the idea if you can read through those examples. So mainly emphasizing what you're passionate about, what type of position you're interested in, and, you know, what skills, experiences you can bring. Okay. And then typically what follows the statement is your education. So just kind of pretty straightforward here. Just make sure that you're including your full degree, not just that you're a public health student, but that you're receiving a master's of public health. Include Oakland University, and then it's also important to include your expected grad date. Especially, I heard from a couple of you that you're first year students, so graduation is going to be maybe a year or two down the road. So you could put expected April 2026, or whatever the case may be. You want to include month and year. And then I'm going to talk about this, and then I'm going to show you some examples of how you can include your related courses and course projects. So again, if you haven't done your practicum yet and you have limited experience, there may be more of an academic focus to your resume. So including courses from your program, the titles of your courses can be helpful to give the employer an idea of, what you've learned, what you have an understanding in through those courses. And there's a wide variety of courses in the public health program. And so I think it's good to showcase that to an employer. So, the titles of the courses, epidemiology, health policy, research methods, health education, just to kind of, again, show that diversity. You don't have to put the number of the course there. And then course projects can be really great too, because that's an example of you applying what you've learned, right? So your capstone project, if the projects that you've done through your program and planning and implementation course projects, again, sometimes you're working with an outside community member and things like that. So even if it's done through a course, it's still practical. It's still good experience, right? That you can showcase. So for the courses, you're just going to put the title of the course and that's it. But for the course projects, and you would title these sections related courses, public health course projects. You're going to put just like a summary of the project of what you focused on. And if it was a group project, what your main responsibility was. And then you can include if you are involved in the public health student organization, public health professionals, as well, just to show that involvement that you've had while you've been a student in the program. So you could put member of public health professionals organization. So that can be important to show because you want to give an idea of all of the things that you have going on, right? So if you're working and involved in student organizations and taking classes full time, that shows time management, organizational skills, and things like that. And so from there, then we really get to the bulk of your resume, right? Your experience sections, and that's where you're going to list all of your experience. So you have an option here. I know a lot of times students will just dump all of their experience into the work experience and practicum and everything into one section. And you're definitely welcome to do that, but make sure that you keep in mind every section is reverse chronological order, right? So you start with your current position or your most recent position and work your way back. If you really want your public health experience or related experience to be the focus, you can divide your experience into two sections. You would have that public health experience, and then you would list your practicum, any volunteering that you may have done that relates to public health, and any organizations and things like that. It could also be research with faculty, right? That could be lumped under that related experience, that or public health experience section, and things like that. So if you've had research assistant positions, or you've been involved in multiple research projects with faculty, or you've had research experience outside of OU, then you can create a research section just to emphasize all of that experience. And then any additional work experience that you've had outside of public health. Let's say in your undergrad, you worked on campus at your university, or you had a career prior to this and you have additional work experience. You can list that as well. You just want to make sure within that work experience, like I mentioned earlier, you're focusing on responsibilities that relate to public health. So maybe leading committees, right? Or maybe you had the opportunity to do some programming or event planning through any of your positions. Managing employees, showing that those leadership responsibilities are really important. And then emphasizing, like I mentioned earlier, those transferable skills that they may be looking for as well, those soft skills, like leadership, communication, problem solving, critical thinking, and things like that. What I can do is at the end, I will share with you the link to this presentation because I have this experience section hyperlinked to an MPH sample resume. And if I forget to share the link at the end, I will email it to all of you. I have down here who attended, but so this resume sample is an example of some of the things that we talked about, right? So they have now they don't have a statement at the top, so keep that in mind. It's not required, but it is something that you can add. But you can see how they listed their related courses here. And then they have their undergraduate degree, which you definitely don't want to forget to include that. And then you can see their experience that they have. So they just kind of lumped all of their experience into one section, but they have their research assistant position, their internship. They've done some project coordinating at Crittenton, and then they were a TA, teaching assistant here at Oakland University. And so you can see just kind of how it's set up and how it's organized. And we're going to talk a little bit in a minute about the statements themselves and, how you can make them a more accomplishment focused. But you can kind of see the example here. And then they have some other information at the bottom that we'll get to in a second. Okay. And so any questions about the experience section or anything we've talked about so far? Okay. So as I mentioned, and then we'll hop back over to the resume sample so I can show you some specific examples in addition to the one on this slide. But a lot of students ask me, I've been applying, I haven't heard anything back. How can I really get my resume to stand out to an employer? We talked about including your skills and experiences and things like that. But when you're including those experiences, the goal, if at all possible, with as many statements as possible, would be to include achievement statements, right? So you're not just talking about what you did, like the example here, assisted with a Healthy Start program. You're talking about including also how you did it and why, or the result, right? So that additional information, the how and why, or the result, is really going to allow you to show what impact you had in that particular role, right? You can really demonstrate your value by demonstrating impact. So I know it's not possible to do this with every single statement in those experience sections, but try to do it with as many as possible. So instead of just saying that you assisted with a Healthy Start program, you're going to talk about how you did that by facilitating home visits, and then you can quantify with 15 postpartum women, and then the why or the result to educate them about healthy behaviors. So I know sometimes when you get into your internship or practicum experience, the result can be a little bit difficult because it's a short time position, right? It's just a summer role. And sometimes, you don't get all the way to the result, and that's okay. But if you include the what you did and how you did it, I think that's really important, and that can be enough. So if you look here at the example of what we had listed here, you can see some of those accomplishment related statements. So for the research assistant position, collected and analyzed resulting survey data to begin to address where cultural competency may be strengthened in order to improve care and outcomes of those served. I know some of you may be thinking, wow, that's a lot of information, that's a lot of detail, but yeah, it's okay to have your statements 1 to 2 lines, right? Now, obviously, we don't want to be writing long paragraphs and things like that for these statements, but if you can include the what and how, and then within most of those statements, within 1 to 2 lines, then that's fine. And then here's another one for the World Health Organization: performed qualitative and quantitative analysis on national health documents for 15 priority states. Why? To identify weaknesses and areas for improvement in funding proposals from national governments. So that's kind of the goal of what we're going for. And then again, you can take a closer look at this example and read through some of those statements as well. But I thought it would be helpful showing you some examples from our resume sample. Okay, so those are really truly the main sections that you'll have on your resume, right? When it comes to what's typically included or required. So some of the additional resume sections, and this one is really kind of separates public health student and alumni resumes from other programs, is some of these sections here. So if you are involved in, like I said, the public health student organization here on campus, but you're also involved in professional associations in public health that are public health related, you could separate this out and more toward the bottom have like a professional associations section or professional memberships. The wording is really up to you and how you list the resume title or the resume section title. But and then you would include the name of the organization, whether you are a member or especially if you've had like in this could be in your undergrad too. If you are president or vice president of a student organization, that's good to include. But at least you want to include the name of the organization, the fact that you're a member, and then the dates that you've been a member of that organization. Professional associations are great things to get involved in. It's cheaper as a student to join a professional association. There's national, there's regional, there's state professional associations, and like I said, if you can join as a student, it's a reduced rate. And it's also sometimes they'll hold networking events or conferences that are great networking opportunities. Also, again, I've reviewed several resumes of public health students, and I have seen some of those students have the opportunity as they're working side by side with faculty members have the opportunity to work on research for that with that faculty member and then contribute to a publication or co-facilitate a presentation at like a state conference or a national conference or something like that related to the research that that student is working on with that faculty member. So I tried to give you, and you may know this already, but just a kind of a format for including that publication example. So you would add yourself and then as well as any other, your faculty member, any other contributors or authors in, and then you would put the title of the publication, the journal that it was published in, and then the date. So even if it hasn't been published yet and you're waiting to hear back, you know, you can indicate that, right? You can still list the publication on your resume. If it is a presentation, same kind of thing, right? The name of the presentation, who you facilitated it with, or if you facilitated it by yourself, that's fine. The conference or where you presented, the location, and then the date of that. So kind of similar format there. And if you have that opportunity, yeah, I know some of you are just starting the program, so maybe not yet, but really, really great opportunity. And it's really great to have that on your resume. Okay. And then again, if you've had some training that you've completed, I gave you some examples earlier with the Narcan or, CPR and all of those types of things, you can add that. And then if you've attended some conferences, you can include that as well. Even if you didn't present, if you attended a conference as a professional development opportunity, and if you haven't yet, these are things that you can look forward to in the future potentially. You would want to put that, the fact that you attended the conference. So you put the name of the conference, the location, and the dates. If you have both of these things listed, maybe you could do professional, you could list the section as professional development. And then that could include like your trainings, certifications, conferences, and things like that. Or you have the option if you have multiple certifications, again, to separate it out into a certifications section. So I think it's important to keep in mind that there's no one set way to do a resume. It's really everyone's situation, everyone's experience is a little bit different, right? So these are just some general tips, and you need to kind of figure out what would work best for you. As far as the different sections and the order of the sections, like you can rearrange the order. So if you want to emphasize your research experience, even over some of the other work experience that you've had, or even your practicum, you can rearrange the order of those sections to emphasize your research experience if that's what you're looking to do after you graduate, right? So those can be kind of moved around as it relates to like related experience, research experience, and things like that. Typically, your education is listed at the top until you've graduated and you've been out of school for a year or two. Then you can kind of move that more toward the bottom of the resume. So it's flexible. So just to give you maybe just some final tips. Again, we talked about the 6-second rule, right? Really quick scan of your resume by these employers. Some of them might even be sending it through an ATS system to scan it, right? To look for keywords, key skills, and things like that. So again, that's where that customization really, really comes into play. But because of your preparation, you've gone through an undergraduate degree, now you're in a graduate program, and you're doing some of the things that we talked about through the program, through your classes and working with faculty and your practicum. Sometimes it's really difficult to keep that all to one page, right? So you may have heard, oh, all resumes have to be one page. And that's a hard set rule. But I think if you're in a situation where you're cutting out important information to maintain that one page, that's a red flag for me. That's where I think it's okay for you to have maybe a page and a half or up to 2 pages for your resume. So definitely keep that in mind. Just consistency is very important with resumes. You want to make sure that the type of font you use, the spacing, the size of the font, the verb tense, that you're consistent with all of that throughout your entire resume. For verb tense, any position or anything that you listed on your resume that you're currently doing should be in present tense. Any previous positions or activities or involvement that's in the past should be in past tense. So make sure that you follow that format. And then definitely make sure that, I know sometimes when it comes to resumes, you spend a lot of time on it, right? And sometimes you tend to overlook some things if you looked at something for a long time. So like I said, we have resources here to support you through the resume appointments that I talked about earlier with our SHS Career Ambassadors, myself, definitely have someone review your resume before you submit it. So that's really important, just to make sure that you didn't overlook something. So again, I wanted to share with you, we do have some additional samples in our resource library in Handshake. So let me just show you how to access that really quick, and I will also share the example with you that I had. So if you just click on Career Center, and then resources, we have resource information on a variety of topics, and we do have resume information up here. But if you keep going and you scroll down to the School of Health Sciences, we have resource information specific to the students in that school. And so you can see, if you keep scrolling, we have some great information on exploring careers and job search and networking. We have a general resume guide that you can take a look at, general cover letter guide. And then we do include specific resume samples by program. So you can take a look at those examples as well. If we just go back, another great way, let's say you're really busy, you can't make it to an appointment or your schedule doesn't allow it. This big interview interface, and our ambassadors use this resource as well. it's going to allow you to upload your resume into the system, and then it'll give you feedback on your resume. It's an AI system. Let me show you really quick. So if you go to our website and you click on For Students and then Big Interview, you just plug in your net ID and password. It's connected to that. And then it'll take you to, you might initially, or you shouldn't have to create an account. It'll take you right there. And then you can see where you can scan your resume. And so you would just click Resume AI here, scan my resume, and it's like sending an attachment, right? You're going to upload it. It'll take a few seconds to give you the feedback. But let me show you what the feedback could potentially look like. So what you would choose is the SHS General when you're asked to pick a template. So you want to click, that's the one that you would select. And so it'll rate your resume on either bronze, silver, or gold. And so this example was ranked at bronze. So once the resume is scanned and everything, you'll receive an email and it'll look similar to this. And then you can go into the system. It kind of gives you an overview of the areas where you need to improve. But if you view the detailed feedback, then that's where it gives the specific information of the changes that they recommend for your resume. And so it gets identified by readability, credibility, and format. So it'll give you some tips on best practices for your summary statement, what key information you need to include in a general way. And so it gives you that, and then also feedback with your contact information, and things like that. Credibility is really where it gets into like the experience sections and things like that. So once the system knows that your resume is public health, it's going to give you, even if you meet the qualification, the criteria, it's going to still give you some information as like specific skills that you can add to your resume or how to strengthen one of your statements. And so based on your major and the information on your resume, it's going to give you specific suggestions for your resume. And so, yeah, if you click through the different sections, you can kind of see it's definitely going to give you that specific feedback. So it's a really great tool. Again, if you are unable to schedule that appointment and sit down with one of us to get that customized feedback and have that conversation, it can be a great resource for you as well. So you can definitely take advantage of that. Any questions for me at this point?
Hi, Denise.
Hi.
Can you share the link to the big
Mhm.
interview one and all the websites you just went to?
Yep. So let me just stop sharing for a second so I can do that. So let's see. Let me pull that up. So I will just copy the link. And let's see. I will put it in the chat. So if someone can click on this just to make sure that it works. So this is the link to the presentation. And so if anything that's gold is hyperlinked and you can click there. So big interview, making appointments, the link to Handshake where you can get that additional resume resource information, all of it should be in there. Did that work for you?
Yes, it works. Thank you so
Okay.
much, Denise.
Perfect. And that resume, if you click on experience, it'll take you to that resume sample too. So that's that specific one that I showed you. So I just thought that would be the easiest way than, sending like multiple attachments in a follow-up email. So, um, but great. Any other questions from anyone else? Did I cover everything that everyone wanted, that you mentioned in the beginning?
Yes, it was really great presentation, Denise. Thank you so much. It was very
Okay,
informative. And it really did answer a lot of my questions I had in my mind. Thank you for that.
perfect. Okay, great. Thank you. I appreciate that. I'm happy that it did. Great. All right. I can also include in the chat, if you don't have it already, my contact information. Feel free to reach out to me. If you have a quick question or if you want to schedule an appointment, you can reach out to me directly as well. Always happy to meet with you. Again, whether it's your resume, your job search, MEC interview, any of the things we talked about, be happy to meet with you and we can come up with a time that works best for us, whether it's in person or virtually. But yeah, well, great. Thank you everyone for joining. And then next month we'll be talking about interviewing. So I hope to see you at that presentation as well. All right. Thank you.
Thank you.
Thank you. Thank you very much.
Thank you.